Ribeiro-Addy.
Thank you, Mr. Davis. It's a pleasure to serve under your chairmanship. I would like to start by congratulating the member for Hartlepool for securing this important debate. The loss of a baby at any stage of pregnancy or after birth can be an incredibly painful experience for any parent. So I pay tribute to everyone that has and will share their experience of baby loss in this house, because it takes a lot to relive that trauma, but I have heard that it means so much to everybody that hears that we speak about such issues in this house. Sadly, though, when this happens, people are often told that it's one of those things or it just happens. And I remember in my grief being told I wasn't the first woman that this would have happened to, and it was one of those things. And it's heartbreaking that women continue to be gaslit in this way when we know that negative pregnancy and birthing experience can drastically or even fatally change outcomes. And we have to accept that it's not always one of those things and work to come up with solutions to end this. So today I want to touch on two things, and the first is a report conducted by 5 Times More, the Black Maternal Health Awareness Campaign. They conducted a nationwide study of black women's experiences of maternity services in the UK, at the largest of its kind, and the results make for some very shocking reading. The report will actually be presented to Parliament next week, Tuesday, and followed by a lobby by the campaign, where they'll be reiterating the call for the government to set a target to address disparities and close the gap in mortality rates. And all members have been invited, and I put that request to set a target to the Minister again today. The report encompasses the views of more than 1,300 black and black mixed heritage women and their maternity experiences, including a number of black women who've experienced baby loss. As some will know, black women are 4 times more likely to die during pregnancy, labour or postpartum. Asian women are twice as likely, and women of mixed heritage are 3 times more likely. Black women are 40% more likely to experience a miscarriage. Black babies have a 50% increased risk of neonatal death and a 121% increased risk of stillbirth. The 5 Times More report highlights all of the negative interactions that women are experiencing with healthcare professionals, feeling discriminated against in their care, receiving a poor standard of care, and having their safety put at risk of being denied pain relief. And even after experiencing negative maternity outcomes, women continue to report that after these experiences, 61% of the women surveyed said that they were not even offered additional support to deal with the outcome of their pregnancy, something which we have heard today can be widespread. So it's vitally important that when we're discussing maternity care that we're acknowledging these racial biases, and it's vital that to make maternity care safe for all patients, that the level of staffing and the treatment of staff is looked at as well. And that brings me to my second point, because for every 30 midwives trained in this country, 29 are lost. What an indictment on the state of maternity services in this country. And that's one of the reasons why I'm really proud to support March with midwives and all of the awareness that they're trying to raise around the dire conditions that midwives are facing, overstretched, under strain, working in situations they know are unsafe, but pushing ahead anyway at a risk to both their physical and mental health. They don't do it for the big bucks, but the least we could do is pay them decently, which we know that we don't. And all we're asking from the ministers to do today is to address the paying conditions and the shortages that midwives are facing, and just to say that everybody in this room owes their life or the life of one of their loved ones to a midwife, and they deserve better, as do the women and the babies that they aim to care for. Thank you.